How's it going, everyone? Welcome to Anatomy Lecture number 9. Today we're going to talk about the glutes and the hamstrings, two muscle groups. As always, the content that we are presenting here builds on the material we have covered in Anatomy Lectures 1 through 8. So please make sure that you are familiar with that content before you move on to this new content. With that in mind, I just want to go through a quick recap from some stuff we covered in one of the earlier lectures. Our our anatomical terms that we use to describe where things are in relation to one another in the body. So remember, when we are describing the human body, we are describing it from the anatomical position. That is standing upright with the feet about shoulder width apart, with the hands facing forward, down by your side, and your head upright and looking forward. So the anatomical position, that kind of standard body position that we describe all movement from, and we describe all locations from that anatomical position. So if we define something as superior, we mean it is towards the head, inferior towards the feet, anterior towards the front, posterior towards the back. Medial is towards the middle, and lateral is further from the middle of the body. Proximal and distal are a pair of terms that are generally used to describe things in relation to your arms and your legs. So something that is proximal is nearer to your trunk, and something that is distal is further from your trunk. Superficial and deep. Superficial means something that is towards the surface of the body, and deep is something that is away from the surface of the body. Supine means face up, and prone means face down. So if we take an example of each one of those, superior means towards the head. The collarbone is superior to the hip. Inferior means towards the feet. The hip is inferior to the collarbone. Anterior, the sternum our breastbone is anterior to the heart. It is towards the front of the body relative to the heart. Posterior means towards the back. The heart is posterior to the sternum. It is located behind or to the back of the sternum. Medial means towards the middle finger. So in the anatomical position, with the hands down by our side and our palms facing forward, the little finger is medial to the thumb. It is towards the midline of the body. Lateral, again thinking of the hands in that same position, the thumb is lateral to the middle finger. It is further from the midline of the body. Proximal and distal, near to the trunk and further from the trunk. Generally, we use these when we're talking about the arms and the legs. So, proximal, near to the trunk. The knee is proximal to the foot. So the knee is closer to the trunk of the body than the foot is. Distal, further from the trunk. The foot is distal to the knee. The foot is further from the trunk of the body when compared to the knee. Superficial means towards the surface. The skin is superficial to the muscle that lies beneath it. Deep is away from the surface of the body. Muscle is deep to the skin. Supine means face up, and prone means face down. In the anatomical positions, we say the hands are supine, palms facing up, and in the anatomical position, and if we turn the palms backwards, then the palms are now prone. So we've moved our hands from our palms facing forward, where they are supine, to our palms facing backwards, where they are prone. If we move from a supine position to a prone position, we call that pronation. If we move from a prone position back to a supine position, we call it supination. So that's a quick recap of the anatomical terms that we use to describe where body parts are in relation to one another. That is stuff that we have covered in a previous lecture. Just a very quick recap there to jog the memory, refresh the memory on those terms. Moving on to the new stuff that we want to cover today, we said we were going to talk about the glutes, the hamstrings, and a couple of other muscles there as well. The glutes and the hamstrings are two muscle groups. Each muscle group has a number of muscles in it. And these, again, as I've said in previous lectures, when we're talking about muscle groups, it's you need to know that there are the glutes are a group of muscles and there are specific muscles in it, and it's nice to know what those specific muscles are and more details about them. Okay, the same goes for the hamstrings, the quads, the hip flexors, the deltoids, and so on. There are individual muscles within a group. You need to know about the muscles, the grouping of the muscles and their actions. It's nice to know about the specifics of the muscles that are in those groups. So we'll go through those now for the remainder of this lecture. So we are going to start by looking at the glutes. So we should all be familiar with where our glutes are. They are on the posterior surface of the hip. So if we spin our skeleton around here and we start to layer up our muscles, so again, going from the deep muscles towards the superficial ones, the ones that are more towards the surface of the body, we build them up until we have all the muscles of the body added in. So we are interested in the glutes today. There are 3 muscles that we want to refer to in the glute muscle group. The first of them is what we all consider to be our glutes, our gluteus maximus muscle. So if we isolate that and have a look at it, the gluteus maximus there is a large muscle on the posterior surface of the hip joint there. The muscle originates on the ilium, the sacrum and the coccyx. So the ilium, this part of your hip bone up here, your sacrum, which is a group of 5 bones fused together at the base of your spine, and your coccyx is a group of 3 bones fused together at the base of your spine. You should be familiar with those, the sacrum and the coccyx, from a previous lecture on the axial and appendicular skeleton. So our gluteus maximus originates on these 3 bones, the hip bone, the sacrum and the coccyx. The belly of the muscle crosses the hip joint and the muscle itself inserts onto the femur. So this muscle crosses the hip joint. It is going to be involved in movement of the femur at the hip joints. The gluteus maximus specifically is involved in extension of the hip joints. So that is when we want to increase the angle of the joint at the hip. So if we want to pull our femur back behind us, as if you were going to draw your foot back to kick a ball. So the movement that's going on at your hip joint is extension there. We are extending the hip. The gluteus maximus also laterally rotates and abducts the thigh at the hip joint. So we can see there the insertion is on the lateral portion of the femur there. So as the muscle contracts, it can abduct the muscle, pull it away abduct the thigh, pull it away from the midline of the body, and it's also involved in lateral or external rotation of the thigh as well. So again, if you were to twist your foot so it turns away from your body, in your hip joint, your femur is rotating, externally rotating there. So an example of an exercise or something to target this is going to be anything that targets those movements. So specifically extension of the hip joint there, stuff like squats and lunges. They are compound movements involving movements at more than one joint. So we've mentioned squats and lunges in relation to our quadricep muscles, because during those movements we are actively extending our knee, extending our knee, and we are also working to extend our hip joint as well. Okay, so that's our gluteus maximus. There it is in relation to the rest of the muscles in the body. The next one we want to talk about is the gluteus medius, which is this muscle here. Okay, the gluteus medius is located slightly more medial than the gluteus maximus. If we isolate it there, we see part of it is covered over by the gluteus maximus muscle there. So the gluteus medius muscle originates on the ilium. We can see it there on the hip bone up here, the ilium. Crosses the hip joint and it inserts onto the femur. It's involved in medial rotation and abduction of the thigh at the hip joints. So this muscle abducts the thigh, pulls the thigh away from the midline of the body, and it's involved in medial rotation. So this time it's involved in rotation towards the midline of the body, and that's due to just a different insertion point there. So as this muscle contracts, it's going to pull this point around. It's going to turn your foot inwards, turn your femur towards the midline of the body. The gluteus maximus was involved in lateral rotation of the femur in the hip joints. So that is your gluteus medius. So when we pop it back in there, we see that it lies deep to your gluteus maximus. So while we can see a portion of it there, if we strip back the gluteus maximus muscle, we can see that the gluteus medius muscle is slightly bigger than is visible here. We've got the glute and we've got the TFL and the iliotibial tract, which we referred to last week when we were talking about the hip flexors, sitting superficial to your gluteus medius muscle here. The last muscle we want to talk about, the next muscle we want to talk about here as part of the traditional gluteal group is the gluteus minimus. The gluteus minimus is not visible here because it lies deep to the gluteus medius. So if we take it back here, we have another gluteal muscle there, the gluteus minimus muscle. If we look at that one on its own, we see again, like the others, it originates on the hip, so on the ilium. So it's that it starts on the hip bone, crosses the hip joint, and it inserts onto the femur there. Again, very similar to the gluteus medius, this is involved in medial rotation and abduction of the thigh at the hip joint. Okay, so for the gluteus medius and the gluteus minimus, if you wanted exercises that would specifically target those ones, you talk maybe like some banded exercises that target abduction. So if you put a band, an elastic band, an exercise band around your knees, lay on your side and did that kind of clamshell exercise where you work to separate your knees with the band in place, that would specifically target that abduction of the hip, of the thigh at the hip joint, and it'd be a good one to target the gluteus medius and the gluteus minimus muscle there. So together we have the gluteus minimus, we have the gluteus medius, and we have the gluteus maximus there, which are the three muscles of your gluteal muscle group, your glutes. There's one more muscle that I want to mention while we're talking about these muscles here, and that is your piriformis. It's a deep gluteal muscle. So if I strip back those layers there, we'll remove the gluteus maximus, and we can now see the piriformis muscle there. It is this guy here. Now I don't want to select him as part of the that grouping there. So the piriformis muscle is this deep gluteal muscle here. It originates on the sacrum. So if we look there, we can see your sacrum, this bone at the base of your spine here. And if we spin it around, we can actually see that the piriformis originates on the anterior surface of the sacrum there, the part of the sacrum that is towards the front. It crosses the hip joint at the back, the posterior aspect of the hip joint, and it inserts onto the femur there. This muscle, the piriformis muscle, is involved in lateral rotation and transverse abduction of the hip, of the femur at the hip. So transverse abduction, if you flex the hip, so bring the knee up out in front of you, and then if you want to pull your hip or your thigh out towards the side, your piriformis muscle is going to be involved in this one. Now the reason I mentioned this deep gluteal muscle is that it is one that can give us a bit of bother. Sometimes when we have pain in our hip joints, in our glutes, we will target the big glutes, the maximus, the medius and the minimus for a bit of foam rolling, a bit of stretching, but really it's this piriformis muscle here that sometimes needs attention. And one of the reasons that it needs attention is because there's a thing called piriformis syndrome. Okay, and piriformis syndrome is when this muscle here irritates the sciatic nerve. The sciatic nerve is a very large nerve that comes out from your spinal column and runs down along the back of your hip here and down into your lower leg. And pain associated with your sciatic nerve is called sciatica, and that's a very, very common cause of pain in people. One of the causes of sciatica is this piriformis syndrome, where this piriformis muscle irritates the sciatic nerve. So what I want to do is I want to show you the sciatic nerve. So we'll just strip back the muscles back to our skeleton at the moment. So we're just looking at the skeleton on its own there. And on this model here, we can add the nervous system in. So if we add the deepest layer of the nervous system in, we can see our sciatic nerve straight away. So our selected the wrong thing there. The sciatic nerve is highlighted in that fuchsia or pink color there. And that is the nerve we are talking about here. So sciatica is pain associated with irritation to this nerve here. So just while we're doing it, I'll just add in all of the nerves in the body there. So we have them all added in, and actually if we take away the skeleton, what we are left with there is just your nervous system. So we've got the brain at the top and your spinal column running down inside your vertebrae. So your spinal column runs all the way down the inside of your vertebrae there. And all of these nerves that we see here that feed every part of the body provide us with our ability to move and our ability to sense what's going on, and our ability to react to anything that's happening around us are all stem from our spinal column here. So the more important, higher functioning nerves come from the top of your vertebral column here. So as these little branches that come out from in between each of your vertebrae is where all of these nerves originate. So if we zoom in, you can see they all branch out there from one of those parts of the vertebral column. That's why if you damage your vertebral column, if you injure your spinal column and cause damage to your so if you cause damage to your vertebrae, which damages your spinal column inside here, it will affect anything below it. So if you break your neck and damage the spinal column here, nothing below it will work. So all of these nerves that you can see below there will no longer function. If you get damage your back lower down, it's anything below the level of the injury. So it really does matter if you damage your spinal column where the level of the injury is to determine how severe the disability will be following that injury. Anyway, that's a little digression there, just showing you the nervous system of the body, the brain, the spinal column, and all of the nerves that come off it. The one we are interested in is our sciatic nerve, this one down here. So to bring it back to what we were talking about, if we add the skeleton back in, and we'll strip out a bit of that nervous system there. Okay, so now we can see just a bit more clearly that sciatic nerve there coming out from the base of the spinal column. It crosses over the hip joint and runs down the back of the thigh there. Now if we start to add our muscles back in, what we can see is when the piriformis muscle, which is this muscle here, and I'll highlight the sciatic nerve there. If we look at those in a bit of detail, we can see that they run very, very closely to each other, okay? They run very, very close to each other. So if this muscle here is tight or inflamed or bunched up in any way, it can irritate your sciatic nerve. And in 17% of the population, the sciatic nerve actually runs right through the piriformis muscle here. Okay, so they are more likely to experience that irritation of the nerve from the muscle because the nerve literally runs through the muscle and pops out a hole in the other side. They are predisposed to having this piriformis syndrome, where the piriformis muscle irritates the sciatic nerve and causes lower back pain and pain that runs down into the leg there. Sciatica, very, very common. Sciatica is described as either being pain, tingling or numbness deep in the buttocks or lower back and running down along the sciatic nerve down into the base or down into the legs there. So that's why we mentioned that piriformis muscle, because the piriformis muscle itself can cause irritation to the sciatic nerve and cause a bit of sciatica. So with that in mind, when you are looking at the piriformis muscle, if you want to, sorry, that's after going back to the start of my presentation, if you want to stretch the piriformis muscle, you want to do something that is like this stretch that we see here. This is targeting specifically the piriformis muscle because we've got that rotation of the femur and that flexion of the hip joint there that is targeting the specific stretch for the piriformis muscle there, the deep gluteal muscle. Okay, let's get back onto what we are talking about today. So that is your glutes and your piriformis. We want to move on now, and the last thing we want to talk about are your hamstrings. Your hamstrings are a muscle group that are located on the posterior surface of your thigh, the back of your thigh. They are the antagonistic pair. Together with the quadricep muscles, they form an antagonistic pair. So your hamstrings and your quadriceps, an antagonistic pair that will result in movement at the knee joint. So the first of the hamstrings that we want to look at is called the biceps. Oh, wrong one. The biceps femoris. Okay, we've got the bicep femoris muscle, which originates, if we see it there, up on the ischium, part of the lower portion of your hip or your pelvis there. The belly of the muscle runs along the posterior surface of the femur. It crosses the knee joint and it inserts onto the fibula. So that's this bone below in the lower portion of your knee there. Now there's some connective tissue that joins that up there. So if we look, we've got that bit of connective tissue added in there, so we can zoom in and see that our bicep femoris crosses the knee joint and inserts onto the fibula there. So that is one of our main hamstring muscles. It's involved in flexion of the knee joint. It also laterally rotates the leg at the knee, and it also extends the thigh at the hip. So along with the glutes there, because this muscle crosses over the hip joint as well as the knee joint, it's involved in movement at both joints. So sorry, zooms in very close there. So because it crosses the hip joint here, it's involved in extension of the hip, of the thigh at the hip joint. So it works with your glutes to extend your hip, and then it crosses the knee joint as well, and it's involved in flexion of the knee joints. There are 3 hamstring muscles. The next is called the semitendinosus. So the semitendinosus muscle also originates up on the hip joint there, on the ischium, and it crosses the hip joint, runs down the back of your leg, crosses the knee joint, and it inserts onto the tibia this time, not the fibula. So this is the tibia is the larger weight-bearing bone of your lower leg, of your shin. So the semitendinosus muscle there originates on your hip, crosses the hip joint, crosses the knee joint, inserts onto your tibia. The semitendinosus is involved in flexion and medial rotation of the leg at the knee, and it also extends the thigh at the hip. So your hamstrings muscles work again. This is another one of your hamstrings that also works with your glutes and your biceps femoris to extend the hip joint. The last muscle that we want to refer to then, we've got our bicep femoris, semitendinosus, and then we've got this fella here, your semimembranosus. And have a look at that. So very similar to the other ones. The other hamstrings originates on the ischium there at the pelvis, crosses the hip joint, crosses the knee joint, and inserts onto the tibia. So like the others, flexes and medially rotates the knee at the hip joint, and also extends the thigh at the hip joint. So all of your hamstrings, we put the 3 of them together there. That is your hamstring muscle group there. They all originate up on the hip. They all cross the hip joint. So they are involved in movement at the hip joint. At the hip, they are involved in extension of the hip, of the thigh at the hip joint. So bringing that thigh back behind and increasing the angle at the hip joints. Each of the 3 hamstring muscles then also crosses the knee joints. They either cross it laterally or medially and insert onto the fibula or the tibia, and they are all involved in flexion of the knee joint. So if we wanted to bring the lower leg back up behind us here to decrease the angle at the knee, we would be flexing the knee. Your hamstring muscle group are working to do that. And then they are also involved in rotation of the knee joints, but the 2 semimembranosus and semitendinosus muscles, they medially rotate the knee, so they pull it towards the midline of the body. The biceps femoris laterally rotates the knee. It rotates it towards the outside of the body. So they are your glutes, your gluteus maximus, your gluteus medius, your gluteus minimus, your piriformis muscle, and your hamstring muscle group. The hamstring muscle group has your bicep femoris, your semimembranosus, and your semitendinosus. That is all I wanted to cover for today. Please make sure that you revise this topic, review the video and the presentation, and use the other resources that are available on Moodle to you in order to revise this topic. As always, thank you very much for your attention. I'll see you in the next lecture.